Hello, I'm Dr. Wahyu from Medical Faculty of Mataram University. Today, I would like to present our research about allergic rhinitis profile in Medical Faculty of Mataram University students. I will start to explain from introductions, methods and material, result of our study, discussion, and conclusion. I will start to explain the introduction first. As we know, allergic rhinitis is defined as an inflammation of nasal mucosa in the form of abnormality in the nose that is triggered by exposure to allergens and is mediated by immunoglobulin E or IgE. Examples of allergens include pollen, animal dander, and house dust. Typical symptoms of allergic rhinitis are nasal congestions, sneezing, and runny nose. Allergic rhinitis is the most common of all allergic diseases and affects an estimated 400 until 600 million people worldwide and mostly affect developed countries. For instance, USA with prevalence of AR 33.6% and UK with the prevalence 29%. Meanwhile, in Indonesia is only about 1 until 12%. Allergic rhinitis also have some clinical signs such as allergic sinus, which is dark under eye or eye bags, allergic salute, or movement of rubbing the nose with a hand because the nose is itchy, and then allergic crease, transverse line in the lower third of the nose due to frequent rubbing of the nose. And the other one, facious adenoid, which is the facial appearance with a characteristic the mouth is always opened, the roof of the mouth grows concave upwards, and the maxillary teeth are forward. Cobblestone appearance or thickening of the posterior wall of pharynx. And the last one is geographic tongue or the tongue which has a map or geographical pattern. World Health Organization on Area Guidelines exposes the classification AR based on its severity, which is mild and moderate to severe, and frequency of symptoms like intermittent and persistent. There was other methods to define the severity of AR, like Total Nasal Symptom Score, or TNSS. It is a method to assess the nasal symptom, including rhinorrhea, nasal congestion, sneezing, nasal itching, and smell disorder, like anosmia, with score 0 to 3 per items. It classifies the severity based on the total score into mild, moderate, and severe. Furthermore, the severity of AR symptoms can be measured based on TNSS in the form of all nasal symptoms. Allergic rhinitis is not life-threatening, but severe symptoms can affect a person's health because this upper airway disease is recurrent, chronic, progressive, and irreversible at an advanced stage. Thus, it has to be recognized earlier to prevent deterioration of person's health. So, we were interested in conducting research on the profile of allergic rhinitis in students of Faculty of Medicine, Mataram University. The parameters studied were gender, age, signs and symptoms of allergic rhinitis, and the degree of allergic rhinitis based on total nasal symptom score or TNSS. For the methods, We use a descriptive study with a prospective cross-sectional approach as the design of our study. Our sample were the students of Faculty of Medicine, Mataram University, who have qualified the inclusion and exclusion criteria. We collected the data using questionnaires and in Google Form and processed in Microsoft Excel. These are the inclusion and exclusion criteria of the sample. The inclusion criteria including age 17 to 25 years old, student who had allergic rhinitis signs and symptoms, and for the exclusion criteria, we have student who had nasal polyps and student who didn't want to participate and fill the questionnaire. After a month of collecting and processing the data, we got the results as follows. There were 50 students who participated in our study, with female counted to 28 people or 56% and male about 22 people or 44%. Most respondents were 21 years old for 12 people or 24%. The most common symptoms in our study was sneezing more than 5 times per day, counted as 41 people or 82%. The other symptoms were runny nose for 6% and itchy nose for 2%, and both of the runny nose and itchy nose for 10%. In addition, allergic salute became the major clinical signs of allergic rhinitis in our study. It is about 26 people or 52%. The other clinical signs was both of the allergic salute and allergic sinner for 20%. Based on TNSS evaluation in our study, there were 15 people or 30% having mild allergic rhinitis, 20 people or 46% having moderate allergic rhinitis, and 12 people or 24% suffering severe allergic rhinitis. After processing the data, we were analyzing the result and made a literature review for each point of results. For gender distribution, our study is in line with the research conducted by Denny Satria Utama in 2010 in Semarang. That out of 74 people suffering from rhinitis, 54.1% were women, while 45.9% were men. This is also supported by research by Susanti et al. In 2016, with the distribution of the most allergic rhinitis sufferers being women, namely 37 patients or 75.51% and only 12 men or 24.49%. The mean age of onset of allergic rhinitis is 8 to 11 years, and 80% of allergic rhinitis developed by age 20. The female hormone estrogen has an inflammatory effect, whereas the male hormone testosterone has an anti-inflammatory effect. During puberty, higher levels of female sex hormones increase the expression of atopic tendencies, whereas male hormones have a protective effect. On the clinical signs and symptoms, a typical symptom of allergic rhinitis is repeated bouts of sneezing. Basically, sneezing is a normal symptom, but sneezing is considered to be pathological if it occurs more than 5 times per day. Other symptoms, the runny nose, nasal congestion, itchy nose, and eyes can sometimes be accompanied by hyperlacrimation as a result of the release of histamine. In this study, it was also found that the most frequent allergic rhinitis symptoms are sneezing more than 5 times per day for 41 people, and the most common sign was allergic salute for 52%. The degree of allergic rhinitis can be assessed by TNSS. After completing the TNSS questionnaire, total scores were obtained and grouped according to the degree of the allergic rhinitis. In this study, the most common subject had moderate degrees. There were several limitations to this study. First, the sample that is not too large and the population is homogeneous, so that future research can be carried out with different research methodologies and more sample. Second, in further research, total IgE or specific IgE tests can be performed to obtain a more precise and objective allergic rhinitis sample. Besides that, further analysis can also be done about the impact and risk factors of allergic rhinitis. It can be concluded that based on the gender distribution, women are the largest distributor of respondents, namely 56%. Based on age distribution, the largest number of subjects in the study came from the age of 21. Based on the distribution of symptoms, the most prominent symptom of allergic rhinitis in our study was repeated sneezing more than 5 times a day, which was 82%. The most common sign in our study was an allergic salute, and then the highest grade of allergic rhinitis based on TNSS in our study was moderate degrees, which was 46%. These are the references that we use in our research. Thank you for your attention, and hopefully our research could emphasize your knowledge, especially in allergic rhinitis. Thank you.